Welcome back. The Greater Harlem Coalition aims to balance compassion with the call for equitable community resource distribution. Their goal, to put an end to a decades-long practice of concentrating programs in Harlem while also providing support to the neighbors grappling with the systemic and generational disparities in health, economic, social opportunities, and safety. Joining me now is the Harlem community activist and co-founder of the Greater Harlem Coalition, Shawn Hill. And Shawn, good to have you sharing with us. And I got to give my personal disclaimer here. Born and raised in Harlem, and so I'm very familiar with all that goes on out there. And when we talk about the issue of Harlem and the things that are going on by way of this particular matter, very spot on. So let's get right at it. When we talk about lack of fair share, we've got a lot of needs, but yet and still it seems as though with a lot of needs comes a lot of resources. Break it down for us.
Certainly. So thank you very much. I think in the literature, these programs that you're referring to are often known as LULUs. Those are locally unwanted land uses. And so, as you undoubtedly know, and your audience knows, the history of redlining in this country has meant that certain kinds of facilities, certain kinds of programs, whether they be public or private, are frequently located in communities that were formerly redlined and continue to be. And other types of programs or facilities are located in areas that were not redlined. So in our case, in Harlem, the Harlem that you know well, we find that one of the largest concentrations of overdose prevention programs, opioid treatment centers, harm exchange and harm reduction programs are all concentrated in Harlem and East Harlem, as well as, for example, the South Bronx included in that. So we find that the pattern of distribution of addiction treatment programs almost perfectly mirrors the historic 80-year-old pattern of redlining, where neighborhoods and blocks and districts that were redlined in the 1930s are the neighborhoods that today in the 21st century have a disproportionate share of addiction treatment programs.
Yeah, well, I'm gonna say from the outset, I'm gonna ask you this question knowing full well the answer, but I'm gonna have to ask it because that's my job. Somebody's gonna say, listen, having resources is a good thing. Having a lot of resources in a community is a good thing. And your answer is?
And my answer is that addiction treatment programs are a very different kind of program. And in excess, in fact, it can induce a sort of negative behavior spiral. And what we've seen in Harlem and in other neighborhoods around New York City is when there's a density of these programs in a small geographic area, that of course means that a number of people seeking treatment come to partake of the treatment or the needles or medically assisted treatment. Unfortunately, not only they come to the neighborhood, but also we find that dealers who want to prey upon those people who have used in the past and perhaps are vulnerable to re-engaging in addictive behavior. And when the dealers themselves become concentrated in a given neighborhood, that then brings a third group, which are people that are not interested in treatment or care or clean needles or whatnot, but simply want to hang out and buy and get high. And so unfortunately, our model is not currently the model. Right now, the model is to pack programs in communities of color. But our model in the Greater Harlem Coalition is that we would like to see small-scale, effective programs for addiction treatment located in all New York neighborhoods, whether they are white neighborhoods, black neighborhoods, mixed neighborhoods, high income, low income. We think all New Yorkers need access to effective treatment in their communities.
Let's look at some numbers here. I want to take a look at the numbers here. Out of 64 New York State Assembly districts, East Harlem, which is District 68, and Central Harlem, District 70, combined have 18% of New York City's total opioid treatment program capacity. That's about 5,700 patients, despite the two districts only having 3% of the population. And the other number that I want to point out is 36 out of the 64 districts have no treatment capacity at all.
At all. And I think there's a kind of schizophrenia that goes on within the addiction treatment world. On one hand, we've been increasingly told in the last decade or so that addiction is not simply a Black problem or a community of color problem, but it impacts white New Yorkers, middle-class New Yorkers, everyone. And yet, time and time again, we find that the programs to address this scourge and epidemic are concentrated in formerly red-line neighborhoods.
Yeah. I want to talk a little bit more about adult-only shelters and their reaching capacities. What can you tell us about your findings when it comes to adult-only shelters?
So again, we find that adult-only shelters tend to be predominantly located in low-income communities of color. And mostly we find that that happens because communities like East Harlem and the South Bronx, for example, have low levels of social capital. Other neighborhoods like the Upper East Side, which is our neighbor, or the Upper West Side, have very large repositories of social capital. People are able to call upon, a friend who writes for a newspaper or somebody else who's willing to give, pro bono legal support, etc. And so we find that even when neighborhoods such as the Upper West Side or Upper East Side are asked to take part of their fair share, the wall or the resistance or the fight against these programs is intense. We saw that 2 years ago when people were moved because of COVID into the Lucerne Hotel in the Upper West Side, and the media furor and legal action and fundraising that went on in the consequence of just a 200-bed shelter was simply out of keeping with and disproportionate to the Upper West Side's share of single adult shelters.
Yeah, we hear a lot of conversation too, not in addition to shelters, about mental health and the need for equitable and supportive housing for mental health, those who are dealing with mental health challenges. When we look at where we are right now, what is the landscape like from your perspective?
I think, unfortunately, what we have done as a society is we have used the street as our psychiatric facilities. I'm old enough to remember in the 60s, New York State and New York City had a number of psychiatric facilities. They were closed, many of them, because of gross abuse and problems. I think we all remember the film The Cuckoo's Nest, which highlighted the problem of psychiatric facilities. And although there were incredibly systemic problems with those institutions, when they were closed, we didn't have, as a society, a solution for the patients that need care. And instead, we simply asked families who may be struggling themselves or put the patients literally out onto the streets. It's one of those things. The tragedy of America in the 21st century is we are not caring for the people who are some of the most vulnerable and need the most care. We put them on the streets.
Yeah. So, Shawn, I know that there's some legislative priorities out there, things that people should be paying attention to and possibly partnering with in terms of sharing your voice for these particular matters. So legislatively, what's out there on the table that people should be paying attention to that could deal with some of the matters that we just talked about?
Well, right now we have in New York City a fair share guidance, but it is not law. And so anything that we can do to change the fair share guidance to being a fair share law so that all New York neighborhoods need to take their fair share of facilities, programs, and the good as well as the bad. Um, Secondly, I would say at the federal level, one of the things that our coalition supports is the abolition of the current laws regarding the distribution of methadone. Methadone is life-saving treatment for many people, and the federal regulations that force people to attend a methadone distribution clinic on a daily or weekly basis is simply onerous. And we would like to see methadone available at your local pharmacy through a prescription written by your physician. So we would like to abolish the methadone distribution model that is currently in place in America.
Yeah. And when we talk about legislative priorities, obviously we see these things out there. What's getting the most traction right now, and what do you need the most support in?
I think a bill that has been proposed by our state assemblywoman Inez Dickens for the safeguards regarding the overdose prevention centers, I think would be a great first start. We're simply looking for equity, and we want to make sure that these programs, which save lives, which really improve people's capacity to engage in this world as family members, as parents, as colleagues, as neighbors. We want those, but we want them equitably distributed. So all New York neighborhoods, all boroughs need to take their fair share.
When somebody asks you the question, what do the residents of Harlem say when we talk about these particular issues? You're right there. What are people saying?
Most people that we work with and we talk to want to have their fair share, but unfortunately, through decades of systemic oversaturation, these programs have been overly concentrated in a few small neighborhoods, um, and it's simply inequitable. People simply want equity.
Yeah. We've got a big problem in New York City, and that, of course, is that of homelessness. We know Harlem has been hard hit as well. Sometimes I could walk down 125th Street, and you can go to either side of the spectrum. I'm over there by Park Avenue. You'll see that there's an influx right now. It seems as though things continue to be a challenge. From your lens, talk to me about homelessness and what's your take right now?
It's a very complex problem, and as you undoubtedly know, mental health plays a huge role in that, as well as the unaffordability of housing today. Um, as a city, we need to build more housing. We need to build it, and we need to build affordable housing.
We talk about housing, we see a lot of development going up, but the question is that development really affordable and is it attainable for people who are within that community? And then also at the same time, looking at those who are homeless right there. As you're looking out and looking at the landscape over there, you can't be too happy with all that you're seeing in this regard.
Exactly. We need to find better mechanisms, financial, legal, that that permit and encourage mixed income housing. Ultimately, my perfect vision for this would be that wealthier neighbors in the same complex end up subsidizing people with fewer resources and who need a leg up. So, mixed income housing with deep affordability. We need to get on this because at the moment we are in a housing crisis, as you point out.
Yeah, and I also want to get the opportunity to get your take on some harm reduction programs. We talk about that. There's plenty of harm reduction programs that are out there, but from your perspective, your landscape through the lens of Harlem, what do you see?
So, one of our concerns is that harm reduction programs have been so intensely focused on the user that they've actually failed to consider the residents nearby. And we are advocating a model of community harm reduction, which encompasses people who need treatment, need services, need referrals, need access to clean drug use paraphernalia, etc., but also considers the needs of the neighbors around, and whether that has to do with needle litter, loitering, increased drug dealing, etc. So we really envision this model of community harm reduction. That community harm reduction takes place both in the facility, but also outside on the street, on the sidewalk, and on the stoops.
Yeah. And as we look towards, this harm reduction, or look at harm reduction, I should say, are you satisfied by what you're seeing? I mean, in terms of, we got a lot of people out there, on the street, um, but the question is, are things going the way they really should be going? And so take that a little bit further for me.
I think that harm reductionists are trying very hard and have been extremely successful in reducing the amount of the transmission of HIV, as well as hepatitis. They've been fantastic with that. Their work in education is incredibly effective. What they are perhaps less effective at is actual moving people from addiction to medically assisted treatment, or moving people from addiction into some kind of recovery situation. So they've been less able to do that. Also, the numbers of overdosing in New York are horrible. We've surpassed over 3,000 annual overdoses in the city. The South Bronx and Upper Manhattan are particularly hard hit, and we need to do more. And I'm hoping that the harm reductionist in New York City will take a close look at what they're doing, and revise and update, because at the moment the the fentanyl crisis is simply continuing to grow.
Yeah. We're getting short on time, but I do want to get our people connected to you and the work that you're doing. For people who want to get connected, what's the best way for them to do that?
Just head to greaterharlem.nyc.
Yeah. And for yourself, as we point, I mean, it's kind of hard to say, but we're almost at the place where we're talking about the end of 2023. But as we're looking towards 2024, what do you have your eyes set on as far as work in Harlem is concerned?
I think we're looking forward to mobile van distribution of methadone being located on Ward's Island. This is life-saving medicine that is needed by many people who want to get off opioids. So we're very excited about that. And I think that's the main thing we're looking for by the end of December. It should be in place.
And so December's coming like around the corner, and it's hard to believe that we're talking about that already. But a lot of great things happening in Harlem. But then again, a lot of challenges as well. One more thing before I go, Shawn. Talk to me about community and Harlem residents, how resilient they've been in the face of all of this, right? Because there's a lot they've had to contend with, from the gentrification all the way down, but yet and still, the voices are still being heard.
Most definitely. And, I, as a new resident of Harlem, stand on the shoulders of so many that have come before me, worked tirelessly to try to improve the neighborhood and better the lives of people here. And at the end of the day, we all want to support people on the path to recovery, on the path to healthfulness, and anything that we can do to support them on that is something that is positive. But unfortunately, overly concentrating programs in a small geographic area does not help patients. It only helps drug dealers.
Mhm. Yeah, a lot to talk about there. And I mean, the truth is, you said it best. And I mean, I think there's some work that needs to be done, and we have to continue to be a voice for the voiceless. Thanks a lot so much for being with us, Shawn Hill. He's a Harlem community activist and also co-founder of the Greater Harlem Coalition. And thanks so much for being with us.
Thank you very much.